Hello friends, today I'm going to discuss the difference between aftercare and follow-up ICD-10 codes. Many coders have confusion in coding aftercare and follow-up ICD-10 codes. They don't know the difference between both of them, so they get confused to code the correct ICD-10 code. So today I'm going to discuss what is aftercare and what is follow-up and how they are different from each other. Follow-up codes, actually follow-up is nothing is actually done when a condition has been resolved or the disease has been uh, completely treated, and there are follow-up visits from the physician for the patient, and for those conditions we have to use the follow-up codes. So in short, if I'll say, follow-up is nothing when a treatment is completed, the patient comes for regular checking for the that condition, whether it still is recurring or whether it is still causing some complication to the body. So it is actually nothing but a visit which is done after completed treatment of that particular condition. So here if I'll say in short, follow-up implies the disease, condition or injury has been fully treated and no longer exists. So as I said, it is a follow-up visit where a condition has been fully treated and no longer exists, and used to explain continuing surveillance following completely treatment of a disease, condition or injury. So let us check with an example. A follow-up visit for patient after completing a regime of IV antibiotics for recurring pneumonia. So a patient comes for a completely after completing his regime of antibiotics for pneumonia. So here the pneumonia has been completely resolved, and the patient is coming follow-up visit to check whether the pneumonia has been is recurring again, or whether it has been causing any complication to other parts of the body. So here the follow-up visit will be coded as Z09. Since that we have to give an info about the treated disease which has been completely removed or completely treated, we have to give a history code as well, which is here pneumonia. So history of recurring pneumonia, which has to be coded along with follow-up code. So here the history code is Z8701. So one more example I can tell, like where neoplasm is removed and a patient come for a follow-up visit. So then in that case, instead of Z09 you have to use Z08, and you have to give a history code of that particular part of neoplasm. So if it's like a neck neoplasm, you have to give a history of neck neoplasm code along with Z08. That is for neoplasm, but other than neoplasm you have to use Z09. So what is aftercare? Aftercare in that case, here the patient is still getting treatment and the patient is still having the disease or the condition. So patient requires continued care during the healing or recovery phase or for the long-term consequences of the disease. Typically this is in the global period. So here one example is the return visit of an unspecified fracture of lower end of the right femur. Since the patient is returning for treatment and during the healing and recovery phase, the diagnosis code for the injury is S42401, which would have a 7-character D to indicate that the encounter is a subsequent encounter for aftercare with routine healing. So in ICD-10 we used to in ICD-9 we used to give a Z code for aftercare, but in ICD-10 the aftercare code is here for injury is given using a 7-character, which is D. So here the 7-character D indicates the patient as a subsequent encounter for aftercare with routine healing. So here in short, if I'll say the main difference between aftercare and follow-up is, in aftercare the patient will still be having disease and getting continued care, but in after follow-up a patient would have completely treated with that disease and coming for follow-up visit just to check the whether the disease is still recurring or and causing any problem to other parts of the body. So this is a main and basic difference between aftercare and follow-up. So if you have got some good knowledge from this video, please subscribe to my channel and please share this info with your friends as well. Thank you for watching this video. Thank you.